So many GPs develop a special interest in a part of their work. And for many GPs in Australia, that's skin cancer. It doesn't really matter what interest you develop, it depends what fascinates you in your practice. It might be men's health, it might be women's health, child health. Some people do mental health. It doesn't really matter, but skin cancer is pretty common as an area of special interest. And it's interesting talking to GPs that develop a special interest in skin cancer about why they do it and the fulfillment they get from it. I think there's 2 or 3 key themes that come through all the time. The first one is there's a lot of work. There's a lot of skin cancer in Australia, and depending on where you're practicing in the country, of course, it can be a significant proportion of your actual clinical work. When you develop a special interest, you become something of an expert, and you will find that your colleagues will send patients along to you, and that's a really nice feeling as a GP, that your colleagues in the practice and practices around you become aware of your interest, your expertise, and your additional ability, and they'll send patients to you. It's really enjoyable to develop a depth of interest and knowledge about a topic. Even if you don't use that knowledge all the time in clinical practice, it's actually interesting to go into depth and even read original research and the literature that's published regularly about the stuff that you're interested in. The other thing of great benefit about skin cancer is it's procedural. So for those of us that like doing medicine with our hands, the opportunity with skin cancer is to spend quite a bit of your time doing biopsies and doing excisions and repairs. Now, most of us do ellipses and close the hole with a very simple suturing, but still it's quite nice to do all of that physical work. And of course, if you want to, you can extend your skills and do quite complex excisions and repairs with flaps and grafts. So the physical side of the work and the break that gives you from the consultation practice is very attractive. And of course, it's quite well paid by Medicare, it's quite well remunerated, and of course, that's an additional benefit as well. So those are just some of the reasons why developing a special interest, and particularly in skin cancer, is well worth doing.